Water is not just a passive solvent. It is the primary medium for almost every biochemical process in the body. About 50 to 70% of an adult's body mass is water, distributed between intracellular fluid, roughly two-thirds of total body water, and extracellular fluid, plasma, and interstitial fluid. That distribution is tightly regulated because cell function depends on both fluid volume and the concentration of dissolved solutes, electrolytes. Fluid balance is maintained by a set of physiological controllers: thirst sensing in the hypothalamus, antidiuretic hormone, vasopressin, that adjusts renal water reabsorption, and the renin, angiotensin, aldosterone system that helps retain sodium and water. The kidneys are the final arbiter of water balance. They concentrate or dilute urine to keep plasma osmolality within a very narrow range. How much water you need depends on body size, activity, environmental heat, altitude, health status, pregnancy or breastfeeding, and the water contained in the food you eat. Two commonly used reference points are the U.S. Institute of Medicine's adequate intakes, which estimate total water intake from food and beverages at 3.7 liters/day for adult men and 2.7 liters/day for adult women, and the practical rule of thumb of about 30 to 35 milliliters per kilogram of body weight per day. So a 70 kilograms person would aim for roughly 2.1 to 2.45 L from drinks plus the portion obtained from food. These are starting points. Individuals adjust upward with heavy sweating, illness, or high heat. Electrolyte balance matters almost as much as fluid volume. Sodium, potassium, chloride, magnesium, and calcium are the major electrolytes that determine osmolality and electrical gradients across membranes. During sweating, sodium and chloride are lost. Prolonged heavy sweating without replacing sodium can lead to hyponatremia risk if a person drinks large volumes of plain water that dilutes serum sodium. Conversely, inadequate free water intake raises plasma sodium, hypernatremia, which commonly indicates water loss in excess of sodium loss, for example, from fever, diarrhea, or inadequate drinking. Practical ways to monitor hydration at home are simple and useful. Urine color is an accessible indicator. A pale straw to light yellow generally indicates adequate hydration, while darker amber suggests the need to drink. This method has limitations. Vitamins, foods, and medications can change color, but is broadly practical. Another objective method is body weight tracking. Measure naked weight before and after exercise, or during a day. Short-term body weight losses reflect fluid losses. 1 kilogram is almost equal to 1 L of water. For athletes or anyone exercising, weigh yourself before and after to estimate sweat rate and fluid loss. When exercising, follow a structured approach. Begin well hydrated, replace fluids during activity, and recover by replacing losses afterwards. A good pre-exercise strategy is to drink 5 to 7 ml/kg of body weight at least 4 hours before exercise. If urine remains dark, take another 3 to 5 ml/kg about 2 hours before starting. During exercise, aim to limit body weight loss to less than 2% in many recreational settings. For prolonged or intense sessions, lasting 60, 90 minutes or in high heat, replace fluids regularly. A practical guideline is sipping 150 to 350 milliliters every 15 to 20 minutes, adjusting for sweat rate and comfort. To calculate sweat rate, weigh before and after exercise. kg difference times 1000 equals ml lost. Add the volume of fluid you drank during the session. Subtract any urine produced. Divide by session length to get ml/hour. After exercise, replace roughly 125 to 150% of the fluid volume lost over the next several hours. For example, if you lost 1.0 L, aim to drink 1.25 to 1.5 L during recovery to account for ongoing losses and to reestablish normal balance. If sodium losses were high, heavy, salty sweat, or multiple prolonged sessions, include salty snacks or a sports beverage with electrolytes to restore osmotic balance. Not all fluids are equal. Plain water is appropriate for routine hydration and for sessions of low intensity or short duration. For prolonged, high-intensity exercise or heavy sweat, drinks that contain sodium and carbohydrate, sports drinks, help maintain plasma sodium, restore electrolytes, and provide a quick energy source. Typical commercial sports drinks contain sodium and carbohydrate concentrations that aid absorption and delay fatigue. For rehydration during diarrhea, vomiting, or illness, oral rehydration solutions, ORS, formulated with the correct sodium-glucose ratio, are optimal because glucose cotransport with sodium enhances water uptake in the gut. A simple emergency household ORS that is widely used is 1 liter of clean water plus 6 level teaspoons of sugar plus 1/2 level teaspoon of table salt. This is intended for short-term home use when commercial ORS is unavailable. Be cautious with high-sugar homemade drinks and cola or fruit juice for rehydration. Their osmolarity can be too high and may worsen diarrhea in some cases. Coffee and tea do contribute to fluid intake. The mild diuretic effects of caffeine do not negate their hydration benefit at usual consumption levels. Alcohol is dehydrating and should be avoided when the goal is rehydration. There are real hazards at both ends of the spectrum. Dehydration ranges from mild thirst, dry mouth, decreased urine output, lightheadedness, to moderate, marked weakness, rapid heart rate, low blood pressure, standing confusion, to severe, very low urine output, very dry mucous membranes, rapid breathing, hypotension, shock. Conversely, overhydration, especially when accompanied by inadequate sodium intake or excessive kidney retention, can cause hyponatremia, low blood sodium, which presents with nausea, headache, confusion, seizures, and, in severe cases, coma. Those at higher risk of hyponatremia include endurance athletes who drink large volumes of plain water during long events, people with impaired renal water excretion, and those taking certain medications, e.g., some antidepressants, certain antiepileptics, or thiazide diuretics. If you feel severe headache, nausea, confusion, or seizures after consuming large amounts of water, seek medical attention promptly. Special populations need tailored guidance. Older adults often have blunted thirst and reduced renal concentrating ability, so habitual sip-based strategies and scheduled drinking are useful. Placing a water bottle within reach, setting reminders, or drinking with each meal helps. Infants and young children dehydrate quickly and need careful monitoring. ORS and medical advice are essential for any child with significant vomiting or diarrhea. Pregnant and breastfeeding women need increased water intake because of higher blood volume and milk production, aiming for an extra 300 to 700 ml/day above baseline, and following healthcare provider guidance is common. People with heart failure, advanced kidney disease, or certain liver conditions may require fluid or sodium restrictions and must follow clinician instructions rather than general rules. Likewise, people on diuretics or with uncontrolled diabetes should check with a clinician about optimal fluid and electrolyte strategies. Practical, everyday tips that work. Keep a refillable bottle at your desk and aim to finish it several times per day. Drink a glass of water when you wake up and with each meal. Use water-rich foods, cucumbers, lettuce, watermelon, citrus fruits, soups, broths, to contribute to your total. Flavor water with slices of lemon, cucumber, or a splash of fruit juice if plain water is unappealing. Avoid relying solely on thirst if you are older, sick, or exercising heavily. Use scheduled sips. For long trips or high heat days, plan ahead and carry more than you think you'll need. If you're trying to manage nighttime bathroom visits, reduce large volumes of fluid within 2 to 3 hours before bed while making sure to drink adequately during the daytime. When to see a clinician. Inability to keep fluids down for more than 24 hours, signs of severe dehydration, very low urine output, persistent dizziness or fainting, very rapid heartbeat, confusion, symptoms of hyponatremia, severe headache, vomiting, seizures, altered mental state, or if you have a chronic medical condition, heart, kidney, liver disease, that could be worsened by changes in fluid intake. For any ongoing concern about fluid needs, for example, preparing for heat exposure, planning endurance events, or managing medications that affect water balance, a healthcare provider or sports medicine clinician can give individualized advice and may check serum electrolytes if necessary. Finally, a short, practical routine to adopt today. Begin each morning with a glass of water. Sip 200 to 300 milliliters every 1 to 2 hours during your waking day, more with activity or heat. Weigh yourself before and after moderate/strenuous exercise to guide replacement. Use a sports drink only when exercise or sweating is prolonged and heavy. And keep a small ORS recipe in mind for illness. 1 L water plus 6 teaspoons sugar plus half a teaspoon salt, when appropriate. Track urine color and body weight changes as simple feedback and consult a clinician if you have underlying disease or if you notice severe symptoms.